A concerning rise in stomach cancer among young adults has puzzled scientists, as cases in older people continue to drop. Doctors are investigating the link between a common bacterial infection, Helicobacter pylori, H. pylori, and this disturbing trend. Could a simple antibiotic cure be the key to preventing this deadly disease in its early stages? The spike in stomach cancer cases among adults under 50 has left experts grappling for answers. While cancer rates among older generations are declining, there's been a steady 2% increase annually among younger individuals. This unsettling rise is compounded by the fact that, in about half of these cases, the cancer is already in advanced stages, rendering it almost fatal, with a bleak survival rate of just 4%. Given the severity of this issue, a team of doctors led by Dr. Jessica Chef-Butata has launched a groundbreaking study to probe whether chronic infection with H. pylori, a bacteria known to cause stomach ulcers, could be a significant contributor to this surge in younger patients. H. pylori is a common bacterium, present in about 40% of the global population, with most carriers never experiencing symptoms. However, in a small percentage of cases, it can cause bloating, indigestion, or more severely, stomach ulcers. Long-term infection is a known risk factor for stomach cancer in older adults, but there's still uncertainty about its role in younger individuals. What makes this connection particularly intriguing is the fact that treating H. pylori with antibiotics could potentially prevent cancer before it ever develops. Some countries, like China, have seen a significant drop in stomach cancer rates through widespread testing and treatment for this infection. However, applying this method to younger patients in Western countries is still under debate, as researchers aim to determine whether H. pylori plays an equally strong role in the rise of early-onset stomach cancers. One case that brings the human toll of this theory into sharp focus is that of Zach Wilcox, a 40-year-old software engineer who tragically passed away in 2021, just 3 months after being diagnosed with stomach cancer. His mother believes Zach may have contracted H. pylori during a trip to India, where 80% of the population carries the bacteria. His initial symptoms were mild indigestion and stomach pain, but by the time the cancer was detected, it was too late. Zach's case has since inspired a campaign to promote a 7-pound H. pylori test, underscoring the importance of early detection and awareness. While pinpointing the exact causes of stomach cancer in young adults is still ongoing, experts are beginning to see potential links between dietary habits and gut health. Dr. Chef-Butata and her team are particularly concerned about the role of ultra-processed foods and low-fiber diets, which are known to increase the risk of colorectal cancer. These diets, often high in sugar and processed ingredients, may also foster harmful bacteria in the gut, further raising cancer risks. However, more research is needed to clarify which specific dietary factors could be driving this alarming trend in stomach cancer, especially since the stomach's environment differs from that of the colon. As the research progresses, Dr. Chef-Butata hopes to uncover meaningful results within the next 6 to 12 months. Her goal is to better understand the risk factors that could help catch stomach cancer earlier, or ideally, prevent it altogether. This involves a multi-level approach, analyzing factors such as chronic H. pylori infection, obesity, and even socioeconomic elements like living in food deserts or having limited access to healthcare. If successful, these insights could open the door to new prevention strategies, offering a lifeline to young adults at risk for this often deadly disease. With stomach cancer cases rising sharply among young adults, the urgency to understand its causes has never been greater. As scientists investigate whether a common bacterial infection might be at fault, there's a glimmer of hope that a simple, preventive treatment could save countless lives. For now, the medical community eagerly awaits the results of these studies, which could hold the key to reversing this disturbing trend and ensuring earlier detection and better outcomes for young cancer patients.